And today, last but not least, with male versus female, is the male disorders. So the first one we're going to talk about is cryptorchidism. This sounds fun, doesn't it? Spoiler alert, it's not. So I always think crypt is like where you bury someone. Orchid is the medical term. I know it's like a flower, and I don't know why that this is the Latin medical term for testicle. So it's a buried testicle. Let's keep talking about it. So it's an undescended testicle. Remember that boys start out as girls, and so their testes are kind of in the ovary position up here in the pelvic cavity. And as the fetus develops, they're supposed to descend and drop into position down into the scrotum, the sac of the scrotum. So if that doesn't happen and they stay up here, we call it cryptorchidism. This generally is seen in premature babies, and it's really not a problem. It's just that they were born before the testes had the chance to move completely down. So if it happens in premature babies, we just wait and see if it's going to fix, if they'll develop normally. Having cryptorchidism puts you at risk for infertility. So it's not that infertility gives you cryptorchidism. It's that if you have cryptorchidism and you either don't fix or you don't fix it quickly enough, those men can have problems with infertility, because remember that the testes need to be cooler than your body is in order for sperm to live. So if they never drop down and they're still up here, then the sperm that they make die. And so then they're going to have problems getting a female pregnant. It also puts you at a high risk for testicular cancer. Treatment for it is, again, watchful waiting. So a lot of them will give a few months to see if they will descend and drop down into the normal position, especially if it was in a premature baby to begin with. If that doesn't happen within 6 months or a year-ish, we're going to go in and do surgery to drop the testicle down ourselves. Sorry. Cryptorchidism. Moving on. Next is epididymitis. If you remember PID, pelvic inflammatory disease, that was the disease that a female got when she got an STD and didn't get it treated, and it kind of spread backwards and spread up in the body and started affecting everything. And I said that men don't have PID, but they have a version of it. This is the version of it. So men will not get PID. What men will get is called epididymitis. So if you remember the epididymis, that little shrimp that hangs up on the back of the testy, gets all inflamed, itis. Inflammation of the epididymis. Again, this is the male version of PID, of pelvic inflammatory disease. This is generally caused by a bacterial infection, usually an STI, that they did not get treated. So it spread back and spread back and spread back and kept spreading and kept spreading and kept spreading. And finally, once it gets here, it angers things. Symptoms are, just look, that's an angry testicle. So swollen, tender scrotum or testes. Again, it's not necessarily the testicle that's swollen and pissed off, but it's the back of it. And no male is ever going to be like, I think it's actually my epididymis. It's this area. So they're going to think that it's a testy issue or the scrotum itself. Growing pain, it can shoot pain into the patient's groin. And the treatment is going to be antibiotics. Thank the Lord that antibiotics are a thing. Because again, this is caused by bacterial infections. So like gonorrhea, chlamydia, things like that. So antibiotics are going to fix it. And look at this. You can see, okay, so this is the prostate. This would be the bulbourethral. We know things. Okay. Next comes erectile dysfunction. If you have ever watched TV ever, you've seen a commercial for a medicine to treat erectile dysfunction. We call this ED. So a lot of times when people are talking about the emergency room, they'll say that ED. And my first thought is, wait, which one? Erectile dysfunction or emergency department? Usually context clues gives it away. So sometimes we can call this impotence as well. So this is a failure of the penis to either become rigid enough to begin or finish intercourse. So remember that the penis is erectile tissue, that it enlarges and hardens because of blood. So the spongy, remember the fly? Ew. So the spongy tissue in here can fill up with blood, and then that makes it get larger, and then it fills so much that it becomes rigid. If that doesn't work right, then they cannot achieve or maintain an erection. So there's two different categories of common causes. The first category is physiological, meaning body problems. And this is most common, especially older in life. So high blood pressure can mess with this. Remember, it's blood. Diabetes problems always mess with blood. Heart vascular, again, that's blood. Hormone imbalances like low testosterone, things like that. And there are a lot of medicines that come with the side effect of causing erectile dysfunction. As you can imagine, most men will not take those medicines once this starts to be a problem. The other category is psychological. So physiological was your body was the problem. Psychological is your mind is the problem. Not brain, but mind is the problem. So like anxiety, stress, things like that. Treatment. Treat the underlying cause. So if you have high blood pressure, take a pill. If you're stressed out, calm down. If you're taking a medicine that's causing it, stop taking that medicine. There are some medicines that increase blood flow to the penis. I'm sure you have heard of them, like Viagra, Cialis, Levitra, all of those phosphodiesterase inhibitors. They are very popular on commercials. If you've ever seen two old people laying in a bathtub on a hill, that's a medicine for erectile dysfunction. Let's see if there's any. No. So I do want to say that one of the problems with these medicines is that they vasodilate, and so they take a lot of blood to the penis. But also, if you are having a heart attack and you have taken one of these medications in the last 24 hours, we cannot give you nitroglycerin. Because these medicines vasodilate, if we give you nitroglycerin on top of it, it will over vasodilate, and then you pass out and you go into shock, basically. So a lot of times, and in a lot of TV shows and movies, you'll see when people are having heart attacks, they'll say, have you taken any erectile dysfunction medicines in the last 24 hours? Because that's one of the things that we have to screen for before we can give someone the pill that helps the heart attack. All right, next comes BPH, benign prostatic hypertrophy. So benign means not cancerous. Remember, when you have a tumor, that tumor is either benign, which is the good one, or it's malignant, which is the bad one, which means it's cancer. Prostate, and then remember, hypertrophy means to get bigger. So BPH, benign prostatic hypertrophy, is when your prostate gland enlarges as a man, but it is not cancerous. It is idiopathic. What's that mean? Yes, good job. It means that we don't know what's causing it. The idiot doctor doesn't know. We think that it has something to do with hormone changes, though, because it exclusively happens to men as they age. So risk factors are age. Over half of the men that are 50 and over have some degree of BPH. If you live long enough as a man, you will have prostate issues. That's it. If you're lucky enough to live to the age, then it's coming for you. Also, family history puts you at an increased risk for it as well. Again, I'm not saying it's genetic, but it does run in families at least. So symptoms, pee problems. So this, and this are the prostate. It's a complete circle. We're just looking at it that's been cut so that we can see it, right? So here is the angry prostate. And what's this? The bladder. And what's this? The urethra. So your urine is right here, and it normally just drains straight through this wide open road. But when you got the Hulk prostate over here that's all angry, it has squeezed shut the road. And look, can you see as well that it's like pushing up into the bladder? Remember, when the bladder gets pushed on, your brain says, I need to pee. So these men need to pee all the time, but then can't get the pee out, which has to be difficult. So frequency, it's being pushed on, and so it kind of feels like you need to pee all the time. Same with the urgent. You're thinking, your brain is interpreting this as a full bladder and you need to pee, but trouble starting it because you have to force open that road. And then when they can pee, a weak stream comes out and just kind of dribble. It's all sorts of pee problems. Prostate issues cause pee issues just because bladder, prostate. Treatment, usually we're not going to do a lot for this. There are some medicines that are mildly effective in kind of relaxing the prostate, and so it opens up this shut down road just a tiny bit. But if it's really, really, really bad, we can do a surgery to go in and cut away some of the prostate. I think the next slide is, yes, real sorry about this picture, but it's for science. So it's called a transurethral resection of the prostate. We call them TURPs. I used to take care of these patients in the hospital. So basically, transurethral means they go through the urethra. So they do not cut you open. They insert this tool into the urethra, into the urinary meatus, the opening in the penis, insert it all the way up till it gets to the prostate. And then it's kind of like a roto-rooter, like a tiller, if that makes sense. It like and cuts away an opening. It opens the road. They are for sure sedated during this, so don't worry. And then when they come out, we have to give them tons and tons and tons of IV fluid so that they just keep peeing basically constantly for like a day or so. And the blood is just, I mean, it's like they're peeing pure blood. It's a scary thing to see. But as you can imagine, your BPH has to be pretty bad and affecting your life a lot before you choose to go in and have this done as a man. Next comes prostate cancer. So to back up, benign prostatic hypertrophy, a big prostate, but it is not cancerous. It's not going to spread or go anywhere. You don't have cancer. You just have a huge Hulk pissed off prostate, right? So now that's different from prostate cancer. So prostate cancer is going to be almost exactly the same thing, except this one is cancerous. And so it can break off and spread and go different places. This is the most common cancer in a man after 50. The good news is that it is usually very slow growing. So again, if you live long enough as a man, you're going to have prostate issues. And if this is the prostate issue you have, very, very, very few people die from prostate cancer because usually they die from old age before the cancer gets bad enough to spread or to go anywhere. So symptoms are none early, but once the tumor gets bad, once the cancer gets bad, it will have the exact same symptoms as BPH, as benign prostatic hypertrophy. And we're going to have to go in and do testing to figure out which one it is. There's no way to just know. If you tell me your symptoms, there's no way to know that it's one versus the other. We're going to have to go in and test. So treatment, again, watchful waiting. I remember my grandpa was late 60s, early 70s. And he had Parkinson's. I remember the tremors one where you walk real slow and from the neuro system. And he was diagnosed with prostate cancer as well. And I remember my family being like, oh, well, do we need to go to an oncologist like the cancer doctor? And his neurologist, the brain doctor, said, no. He said the Parkinson's will kill him way before that prostate cancer can ever be an issue. It grows very slowly. So a lot of times it'll be years and years and years, and we're just keeping an eye on it. However, if it does tend to be, if it is one of the more aggressive types, and we're worried it's getting big quick, or we're worried about that it's going to spread, then we can do chemo to that. There's prostatectomy. So prostatectomy is the surgical removal of, that's what ectomy means, of the prostate. Men are very hesitant to have this done because there's a nerve bundle in the prostate that is responsible for the ability to get an erection. So a lot of times if you go in and you take out that prostate, it will damage the nerve bundle, and then they will have permanent erectile dysfunction. They will never be able to get an erection again. So a lot of men choose not to do this because they don't want to risk that. And then testicular cancer, I believe, is the last one that we're going to talk about. So risk factors are, all right, so usually when you think cancer, you think like old people, right? Not with testicular cancer. So undescended testicle, cryptorchidism, we already talked about. Family history definitely runs in families. Its highest incidence is in white and obviously males from the age of 15 to 35. So remember, like Hodgkin's was the cancer of the lymph nodes that was in college kids. This is another cancer that typically comes on very early in life. And so we're going to talk about it and the symptoms and how to screen for it because, guys, all of you should be doing testicular self-exams just like the ladies should be doing breast self-exams. So symptoms, scrotal heaviness. It's a sensation that the scrotal sac is heavier than usual. It's not that the tumor is so big that it really is heavy. It's kind of like a hormone thing that it's sending you messages. It can cause back pain, again, a hormone thing, and it can cause breast development in men and tenderness. Fancy word for breast development in men is gynecomastia. And again, that's because of the hormones. And then obviously there can be a lump or an enlargement on the testicle, and that's what we're going to screen for. If you've ever seen the movie Fight Club, don't until you're 18. But there was a guy in Fight Club who had testicular cancer, and he had breast development. It's one of the telltale signs of it. So this is not real. This is a testy. This would be the epididymis kind of sitting on the back here. And this would be the cancer. So I'm going to show you a picture of real testicular cancer. So this is a testy that has been cut in half so that you're seeing and opened up. The stuff that looks kind of like hamburger meat is normal testicular tissue. This is the cancer. So this messes with hormones and messes with everything, and that's what causes most of these symptoms. So treatment, removal of the testicle. Oftentimes when we take the testy out, they will insert like a saline ball, just like a fake testicle in there for aesthetic reasons. But taking the entire testicle is the only way to really get it out. So testicular self-exams. This is telling you where your testicles are, and I feel like that should be obvious by now. This is to do it, and they do teach to do it in a shower or right after a shower because it affects the skin of the scrotum. It relaxes it, and it's easier to palpate through it. And while breast self-exams, we examine standing up and laying down. Generally, the testicular self-exam is best done while standing. So here's the thing. Basically, the tricky part of it is because the testes are sort of oval or round in nature, they will move. So you're going to have to hold the testicle with one hand, and then with the other hand, gently roll the fingers all over the testy to see if there's any lumps or bumps, and then remember to do both sides. Again, family history puts you at higher risk. If you've had testicular cancer before, you're at higher risk. Cryptorchidism, the undescended testicle, puts you at higher risk. And again, 15 to 35 is the number one category of people who have testicular cancer. So please, 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 men, be doing your self-exams just like the ladies should be doing theirs. And I believe that's it. If there's a tomorrow in this class, we're going to talk about pregnancy, conception, babies. Why did I start talking like that? I don't know. You know what? I need to stop this. Okay, bye, guys.